Hello and welcome back to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News, and I'm joined by some of the best and smartest health reporters in Washington. We're taping this week on Thursday, July 17th at 10 a.m. As always, news happens fast and things might have changed by the time you hear this. So here we go. Today, we are joined via video conference by Sandhya Raman of CQ Roll Call.
Hello, everyone.
Shefali Luthra of the 19th.
Hello.
And Joanne Kenen of the Johns Hopkins Bloomberg School of Public Health and Politico magazine.
Hi, everybody.
No interview this week, but more than enough news, so we will get right to it. We're going to start on Capitol Hill, where in the very wee hours of Thursday morning, the Senate approved the $9 billion package of rescissions of money already appropriated. It was largely for foreign aid and the Corporation for Public Broadcasting, which oversees NPR and PBS. Now, this bill represents pennies compared to the entire federal budget and even to the total of dollars that are appropriated every year. But it's still a big deal because it's basically Congress ceding more of its spending power back to the president. And even this small package was controversial. Before even bringing it to the floor, senators took out the rescission of funds for PEPFAR, the bipartisanly popular international AIDS HIV program begun under President George W. Bush. So now it has to go back to the House, and the clock on this whole process runs out on Friday. Sandhya, what's likely to happen next?
I think that the House has been more amenable. They got through quicker, but if
by
you
one
look,
vote.
Yeah, but I think if you look at what else has been happening in the House this week that isn't in the health sphere, they've been having issues getting other things done because of some pushback from the Freedom Caucus, who's been kind of stalling the votes and having them to go back, and other things that should have been smoother are taking a lot longer and having a lot more issues. So it's more difficult to say without seeing how all of that plays out. If those folks are going to make a stink again about something here, if because some of this money was taken out, it's a work in progress this week in the House.
Yeah, that's a very kind way to put it. The House has basically been stalled for the last 24 hours. You say many things completely unrelated, but there is actually a clock ticking on this. They had 45 days from when the administration sent up this rescission request, and we're now on day 43 because Congress is the world's largest group of high school students that never do anything until the last minute. So Democrats warned that this bill represents yet another dangerous precedent. They reached a bipartisan agreement on this year's spending bills in the spring, and this basically rolls at least some of that back using a straight party line vote. What does this bode for the rest of Congress's appropriations work for the fiscal year that starts in just a couple of months?
I think that the sense has been that once this goes through, I think a lot of people have just been assuming that it'll take time, but that things will get passed on rescissions. It really puts a damper on the bipartisan appropriations process, and it's going to make it a lot harder to get people to come to the table. So earlier this week, we had the chair of the Appropriations Committee and the chair of the Labor HHS Education Subcommittee in the House say that the health appropriations we were going to do next week for the House are going to get pushed back until September because they're not ready. And I think that health is also one of the hardest ones to get through. There's a lot more controversial stuff. It's setting us up to go, kind of like usual at this point for another CR because it's going to be a really short timeline before the end of the fiscal year. But if you look
every year they say they're going to do the spending bill separately, and every year they don't.
Yeah. And I think if you look at how they've been approaching some of the things that have been generally a little bit less controversial and how much pushback and how much more difficulties they've been having with that, I mean, even this week, I think that it's going to be much more difficult to get that done. And the rescissions, pulling back on Congress's power of the purse is not going to make that any easier.
I think what people don't appreciate, and I don't think I appreciated it either until this came up, is that the rescissions process is part of the Budget Act, which is one of these things that Congress can do on an expedited basis in the Senate with just a straight majority. But the regular appropriations bills, unlike the budget reconciliation bill that we just did, need 60 votes. They can be filibustered. So the only way to get appropriations done is on a bipartisan basis, and yet they're using this rather partisan process to take back some of the deal that they made. You know, the Democrats keep saying it and everybody's like, oh, process, but that actually could be a gigantic roadblock to stopping everything in its tracks, right?
I really think so. And if you look at who are the two Republicans in the Senate that voted against the rescissions, one of them is the Senate Appropriations Chair, Susan Collins, and throughout this, one of her main concerns was when we still had the PEPFAR in there, but just it takes back her power as the highest ranking appropriator in the Senate to do it through this process, especially when she wasn't in favor of the rescissions package. So it's going to make things, I think, a lot more complicated. And, one of her concerns throughout has just been that there wasn't enough information, that she wanted, she was pulling out examples of rescissions in the past and how it was kind of a different process, that they were really briefed on why this was necessary. It was just different now. So I think what happens with appropriations and how long it'll take this year is going to be interesting to watch.
And it's worth remembering that it's when the appropriations don't happen that the government shuts down. But that doesn't happen until October. Well, separately, we learned that, go ahead, Joanne.
There's also sort of a whole new wrinkle is that rescissions is, if you're a Republican and you don't like something and you end up to avoid a government shutdown or whatever reason you end up having to vote for a bill, you just have the president put out a statement saying, if this goes through, I'm going to cut it afterwards. And then the Republican who doesn't like it can give a floor speech saying, I'm voting for it because I like this in it, and I know that the president's going to take care of that. It really, appropriations is always messy, but there's this whole unknown. The constitutional balance of who does what in the American government is shifting. And at the end of the day, the only thing we do know after both the first term and what's happened so far, even more so in the second term, is what Trump wants, Trump tends to get. So labor age, like Sandhya just pointed out, the health bill is one of the hardest because there's so much culture war stuff in it. But although the Supreme Court has put some of that off the table, but I just don't know how things play out in the current dynamic, which is unprecedented.
And of course, Labor HHS also has the Department of Education in it.
The former Department of Education.
Yeah, I was to say, which is in the process of being dismantled. So that's going to make that even more controversial this year. Moving back to the present, separately, we learned this week that the administration plans to spend hundreds of thousands of dollars of taxpayer money to destroy stocks of food and contraceptives and other medical devices rather than distribute them through some of the international aid programs that they're canceling. Now, in the case of an estimated 500 tons of high-energy biscuits bought by USAID at the end of the Biden administration, you could almost understand it because they're literally about to expire next week. According to The Atlantic, which first reported this story, this is only a small part of 60,000 metric tons of food already purchased from U.S. farmers and sitting in warehouses around the world where the personnel who'd be in charge of distributing them would have been fired or transferred or called back to the U.S. At the same time, there are apparently also plans to destroy an estimated $12 million worth of HIV prevention supplies and contraceptives originally purchased as part of foreign aid programs rather than turn them over or even sell them to other countries or nonprofits. This feels like maybe the not most efficient use of taxpayer dollars.
I think this is something we've talked about before, but it really bears repeating. As a media ecosphere, we've sort of moved on from the really rapid dismantling of USAID. And it was not only without precedent, it was incredibly wasteful with the sudden way it was done. All of these things that were already purchased, no longer able to be used, leases literally broken, and people had to pay more to break leases for offices set up in other countries, all these sorts of things that really could have already been used because they had been paid for, and instead the money is simply lost. And I think the important thing for us to remember here is not only the immense waste financially to taxpayers, but the real trust that has been lost because these were promises made, things purchased, programs initiated. And when other countries see us pulling back in such a, again, I keep saying wasteful, but truly wasteful manner, it's just really hard to ever imagine that the U.S. will be a reliable partner moving forward.
Yeah, absolutely. But I understand the food thing to some extent because the food's going to expire, but the medical supplies that could be distributed by somebody else, I mean, I'm still sort of searching for why that would make any sense in any in any universe. But I guess this is the continuation of we're gonna get rid of this aid and pretend that it never happened. Well, meanwhile, it's only been a couple of weeks, but we're starting to see the politics of that big Trump tax and spending measure play out. One big question is, why didn't Republicans listen to the usually very powerful hospital industry that usually gets its way, but did not this time? And relatedly, will those Republicans who voted with Trump but against those powerful hospital interests do an about-face between now and when these Medicaid cuts are supposed to take effect? We've already seen Senator Josh Hawley, the Republican from Missouri, who loudly proclaimed his opposition to those Medicaid cuts before he voted for them anyway, introduce legislation to rescind them. So is this the new normal? I think, Joanne, you were sort of alluding to this, that you can now sort of vote for something and then immediately say, didn't mean to vote for that, let's undo it.
You could even do it before you vote for it. If they play it right, if Congress passes these things, we're not going to pay attention. I mean, we're already in that moment. But also, I mean, when I was working on a Medicaid piece, a magazine piece, like 4 or 5 months ago, one of the most cynical people I know in Washington told me, he said, oh, they'll pass these huge cuts. And then because they need the score to get the budget score to get the taxes through. And then they'll start repealing it, and it seemed so cynical at the time, only he might have been right. So, I mean, I don't think they're going to cut all of it. I mean, Republicans ideologically want a smaller Medicaid program. They want less spending. They want work requirements. So you're not going to see the whole thing go away. Could you see some retroactive tinkering or postponement or something? Yeah, you could. It's too soon to know. The hospitals are the biggest employer in many, many congressional districts.
Most of them.
This is a power, most, yeah. I don't think it's quite all, but like a lot. It's the biggest single employer. And Medicaid is a big part of their income. And if they still by law have to stabilize people who come in sick, and there's emergency care and all sorts of other things, right? They do charity care, they do uninsured people, they do all sorts. They still treat people under certain circumstances, even when they can't pay. But right now, the threat of a primary opponent is more powerful than the threat of your local hospital being mad at you and harming healthcare access in your community. I mean, so much in the Republican world revolves around not getting the president mad enough that he threatens to get you beaten in a primary. I mean, we've seen that time and again already.
Right. And I will also say there's precedent for this, for passing something and then unpassing it. Joanne and I covered
but it wasn't the plan.
Yeah, I know. I mean, remember, back in 1997 when they passed the Balanced Budget Act, every year for the next, 3 or 4 years, they did what we came to call give back bills.
Or punting. Right.
Yeah, where they basically unspooled some of those cuts, mostly because they'd cut more deeply than they'd intended to. And then, we know with the Affordable Care Act, I've said this several times, they passed all of these financing mechanisms for it and then one by one repealed them.
And the individual mandate. I mean, they kept the dessert and they gave away everything. They undid everything that paid for the dessert, basically.
Right.
And so, it was the Cadillac. I think people don't remember anymore. The Cadillac tax, the insurance tax, the device tax. They all one at a time, and they were repealed.
The tanning tax just went.
Right. So that dynamic existed, passing something unpopular and then redoing it. But the dynamic now really just comes, basically this is Donald Trump's town. He has had a remarkable success in not only getting Congress to do what he wants, but getting Congress to surrender some of its own powers, which have been around since Congress began. I mean, this is the way our government was set up. So there's a very, very different dynamic. And it's still unpredictable. I mean, none of us thought that the biggest crisis would be the Epstein case, right? Which is not a health story, and we don't have to spend any time on it except to acknowledge that there's stuff going on in the background that, people who had been extremely loyal to the president are now mad. But and we don't know how long. He's very good at neutralizing things too. He's blaming it on the Democrats. But there is a different dynamic. Congress has less power because Congress gave up some of its power. Are they going to want to reassert themselves? There is no sign of it right now. But who knows what happens. I thought they would cut Medicaid. I thought they would do work requirements. I thought they would let the enhanced ACA subsidies expire, but I did not think the cuts would go this deep and this extensive. I mean, really transformationally, pretty historic cuts. Not
Shefali,
pretty
want to say
historic
something?
cuts, very historic cuts. Unprecedented.
I was thinking Joanne made such a good point about how, for all of the talk now about trying to mitigate that backlash, a lot of this is in line ideologically with what Republicans want. They do want a smaller Medicaid program. And I think a really interesting and still open question is whether they are willing and able to actually create policy that does reverse some of these cuts or not. And even if they do, if it's sufficient to change voters' perception, because we know that these cuts are very unpopular. Democrats are talking about them a lot. Hospitals are talking about them a lot. And just the failed attempt to repeal the ACA led to the 2018 midterms. And I think there is a real chance that this is the dominant topic when we head into next year's elections. And it's hard to say if Josh Hawley putting out a bill can undo that damage.
Well, I'm so glad you mentioned that, because the Washington Post has a really interesting story about a clinic closing in rural Nebraska, with its owners publicly blaming the impending Medicaid cuts, yet its Trump-supporting patients are just not buying it. Now, in 2010, Republicans managed to hang the Affordable Care Act around Democrats' necks well before the vast majority of the changes took place. Are Democrats going to be able to do that now? I mean, there's a lot of people saying, oh, well, they're not going to be able to blame this on the Republicans because most of it won't have happened yet. This is really going to be a who manages to push their narrative, right?
I mean, this really striking thing about that story is that the people who were losing access, they're not losing their Medicaid yet, but they're losing access to the only clinic within they have to drive hours now to get medical care. And when they were told this was because the Republican Congress and President Trump, they said, oh, no, it can't be. First of all, a lot of people just don't pay attention to the news. We know that. And then if you're paying attention to news that never says anything, negative about the president, that blames everything on Joe Biden, no matter, if it rains yesterday, it was his fault, right? So the sort of gap between there are certain things that are matters of opinion and interpretation, and there are certain things that are matters of fact, but those facts are not getting through, and we do not know whether the Democrats will be able to get them through, because the resistance, it's almost magical, right? My clinic closed because of a Republican Medicaid bill. Oh, no, it's hospital grade. They just don't want to treat us anymore. It doesn't compute because it doesn't fit into what they have been reading and hearing to the extent that they read and hear.
Sandhya, you want to add something?
The one thing that, as I've been asking around on Capitol Hill about, the Hawley bill, and there was one from Senator Rand Paul and a House counterpart from Greg Steube, does sort of the opposite. It wants to move up the timeline for one of the provisions. So one important thing to consider is, neither of these bills have had a lot of buy-in from other members of Congress. They've been introduced, but it's, the people that I've talked to have said, I'm not sure. And I think something interesting that Senator Tom Tillis had said was, if Republicans had a problem with what some of the impacts would be, then why were they denying that there would be an effect on rural health or some of those things to begin with? And I think a lot of it will take some time to judge to see if people will move the needle. But if we're going to change any of these deadlines through not reconciliation, you need 60 votes in the Senate, and you'll need Democrats on board as well as Republicans. And I think one interesting thing to watch there is that I think some of the Democrats are also kind of looking at this in a political way. If there's a Republican that has a bill that is trying to tamp down some of the effects of their signature reconciliation law, do they want to help them and sign on to that bill or kind of illustrate the effects of the bill before the midterms or whatever?
A lot more politics to come.
Yeah.
Meanwhile, over at HHS, there is also plenty of news. Many of the workers who've been basically in limbo since April, when a judge temporarily halted the Trump administration's efforts to downsize, have now been formally let go after the Supreme Court last week lifted that injunction. What are we hearing about how things are going over at HHS? I mean, we've talked sort of every week about this sort of continuing chaos. I assume that the hammer falling is not helping. It's not adding to things settling down.
No, and then Secretary Kennedy just fired 2 top aides because, no one knows exactly the full story, and I certainly do not know the full story, but what I have read is that the personality conflict with his top aide. I mean, and that happens in offices. And he's not the first person in the history of HHS to have people who don't get along with one another. But it's just a more unsettled stuff in an agency already in flux, because now, in addition to all these people being let go in all sorts of programs and programs being rolled back, you also have some leadership chaos at the top.
Well, meanwhile, HHS Secretary Kennedy took office with vows to eliminate the financial influence of big pharma, big food, and other industries with potential conflicts of interest. But shout out here to my KFF Health News colleague, Stephanie Armour, who has a story this week about how the new vested interests at HHS are the wellness industry. Kennedy and 4 top advisors, 3 of whom have been hired into the department, wrote Stephanie, quote, earned at least $3.2 million in fees and salaries from their work opposing big pharma and promoting wellness in 2022 and 2023, according to a KFF Health News review of financial disclosure forms filed with the U.S. Office of Government Ethics and the Department of Health and Human Services, published media reports, and tax forms filed with the IRS. That total doesn't include revenue from speaking fees, the sale of wellness products, or other income sources for which data is not publicly available. Have we basically just traded one form of regulatory capture for another form of regulatory capture?
And one isn't covered by insurance. I mean, not some of it is, but there's a lot of stuff in the, quote, wellness industry that providers and so forth, certain services are covered if there's, licensed people and a evidence base for them, but a lot of it isn't. And these providers charge a lot of money out of pocket too.
And they make a lot of money. I mean, this is totally unlike big pharma, big food, and big medicine, which is regulated. Big wellness is largely not regulated.
I mean, I think, Stephanie, that was a really good piece. And I think Stephanie said it was a, $6.3 trillion industry. Was that?
Yeah,
am I
it's
remembering
huge.
that number right? It's largely unregulated. Many of the products have never gone through any review and for safety or efficacy. And insurance doesn't cover a lot of it. It doesn't mean it's all bad. I mean, there are certain things that are healthful. But as an industry overall, it leaves something for us to worry about.
Well, in HHS adjacent breaking news that could turn out to be nothing or something really big, an appeals court in Richmond on Tuesday ruled 2-1 that West Virginia may in fact limit access to the abortion pill, even though it's approved by the FDA. It's the first time a federal appeals court has basically said that states can effectively override the FDA's nationwide drug approval authority. And it's the question that the Supreme Court has already ducked once in that case out of Texas last year, where the justices ruled that the doctors who were suing didn't have standing, so they didn't have to get to that question. But Shefali, this has implications well beyond abortion, right?
Oh, absolutely. I mean, we are seeing efforts across the country to restrict access to certain medications that are FDA approved. Abortion pills are the obvious one, but of course we can think about gender-affirming care. We can think about access to all sorts of other therapeutics and even vaccines that are now sort of coming under political fire. And if FDA approval means less than state restrictions, as we are seeing in this case, as we are very possibly could see as these kinds of arguments and challenges make their way to the Supreme Court, the case you alluded to earlier with the doctors who didn't have standing is still alive, just with different plaintiffs now. And so these questions will probably come back. There are just such vast ramifications for any kind of medication that could be politicized. And it's something that industry at large has been very worried about since this abortion pill became such a big question. And it is something that this decision is not going to alleviate.
Yeah, so I mean, speaking of big pharma, they're completely freaked out by this possibility because it does have implications for every FDA-approved drug.
And they invest so much money in trying to get products that have FDA approval. There's a real promise that with this global gold standard, you will be able to keep a drug on the market and really make a lot of money on it. There's also obviously concerns for birth control, which we aren't seeing legally restricted in the same way as abortion yet, but it is something that is so deeply subject to politics and culture war issues that that's something that we could see coming down the line if trends continue the way they are.
Well, we will watch that space. Moving on, Wednesday was the 3rd anniversary of the federal 988 Federal Crisis Line, which has so far served an estimated 16 million people with mental health crises via call, text, or chat. An estimated 10% of those calls were routed through a special service for LGBTQ plus youth, which is being cut off today by the Trump administration, which accused the program run by the Trevor Project as, quote, radical gender ideology. Now, LGBTQ plus youth are among those at the highest risk for suicide, which is exactly what the 988 program was created to prevent. Yet there's been very little coverage of this. I had to actually go searching to find out exactly what happened here. Is this just kind of another day in the Trump administration?
I mean, I think a lot of it stems back to some of those initial executive orders related to gender ideology and DEI and things like that. You know, the Trump administration's kind of argument is that you know, it shouldn't be siloed, like it should be all general. There shouldn't be sort of special treatment, even though we do have specialized services for, you know, veterans who call into these services and things.
Although
But
that was only saved when members of Congress complained.
Yeah, but I do think that when we have so much happening in this space focused on LGBTQ issues, it's easier for things to get missed. I think the one thing that I did notice was that, you know, California announced yesterday that they were kind of step up to do a partnership with the Trevor Project to at least, you know, the LGBTQ youth calling from California to any of those local 988 centers would be reaching people that have been trained a little bit more in like cultural competency and dealing with LGBT youth. But that's not going to be all the states, and it's going to take time.
Yeah. We're going to continue to see this sort of cobbled together state by state. It feels like increasingly what services are available to you are going to be very much dependent on where you live. I mean, that's always been true, but it feels like it's getting more and more and more true. Shefali, I see you nodding.
And something you alluded to that I think bears making explicit is public health interventions are typically targeted toward people who are in greater danger or are at greater risk. That's not discrimination, that's public health efficiency. And suggesting that we shouldn't have resources targeted toward people at higher risk of suicide is counter to what public health experts have been arguing for a very long time. And that's just something that I think really bears noting and keeping in mind as we see what the impact of this is moving forward.
Yeah, I think that's a very good point. Thank you. Well, speaking of popular things that are going away, a federal judge appointed by President Trump last week struck down the last-minute Biden administration rule from the Consumer Financial Protection Bureau that tried to bar medical debt from appearing on credit reports. This had been hailed as a major step for the 100 million Americans with medical debt, which is not exactly the same as buying a car or a TV that you really can't afford. People don't go into medical debt, you know, saying, oh, I think I'm going to go run up a big medical bill that I can't pay. But this strikes me as yet another way this administration is basically inflicting punishment on its own voters. Yes?
I mean, yes, except like we just don't know. Like some red states are so red that you don't need every voter. You know, like we don't know who actually votes, and we don't know whether people make these connections, right? I mean, what we were talking about before with Medicaid, do they understand that this is something that President Trump not just urged, but basically ordered Congress to do? So do people pay attention? I mean, how many people even know if their medical debt is or is not on their credit report? They know they have the medical debt, but I'm not sure that everybody understands all the implication, particularly if you're used to being in debt. You may be somebody who's lost a job or couldn't pay your mortgage or couldn't pay your rent. I mean, some of the people of medical debt have so many other financial, not all, you know, but that it's just part of a debt soup and it's just one more ingredient. So how it plays out and how it's perceived, it's part of this unpredictable mix. I mean, Trump is openly talking about gerrymandering more, and so it won't matter what voters do because they'll have more Republican seats. You know, that's just something he's floating. We don't know whether it'll actually happen, but he floated it in public. So
much of this is flooding the zone that there's so much happening that people have no idea who's responsible for what. There's always the pollster question, is your life better or worse than it was last year, 4 years ago, whatever. And I think that when you do so much so fast, it's pretty hard to affix blame to anybody.
And most people aren't single issue voters. They're not going to the polls saying, you know, my medical debt is back on my credit report. There's so many other things that even if with the last election, like healthcare was not the number one issue for most voters. So it's difficult to say if it will be the top issue for the next election or the next one after that. And I guess just piggybacking that, you know, a lot of the times when there's these big changes, they don't take effect for a while. So it's easier to rationalize, oh, it may have been this person or the senator then, or who was president at a different time, just because of how long it takes to see the effects in your daily life.
Politics is messy. All right. Well, that is as much time for the news as we have this week. Now it's time for our extra credit segment. That's where we each recognize a story we read this week we think you should read too. Don't worry if you miss it. We'll put the links in our show notes on your phone or other mobile device. Shefali, why don't you go first this week?
Sure. My piece is from the New York Times by Apurva Mandavili. The headline is Trump official accused PEPFAR of funding abortions in Russia. It wasn't true. And she takes a look at when the head of the OMB told the Senate that PEPFAR had spent almost $10 million advising Russian doctors on abortions and gender analysis. And she goes through and says, this isn't true. PEPFAR hasn't been in Russia. They cannot fund abortions. And she talks to people who were there and can say, this simply isn't true, and this is very easy to disprove. And I like this piece because it's just a reminder that a lot of things are being said about government spending that are not true. And it is a public service to remind readers that they are very easily disproven.
Yeah, and to go ahead and do that. Sandhya.
My extra credit is We're Creating Miscarriages with Medicine, Abortion Lessons from Sweden. And it's from Cecilia Noel for The Nation, my co-fellow through HCJ this year. Cecilia went to Kiruna, which is an Arctic village in Sweden, to look at how they're using mifepristone for abortions up to 22 weeks in pregnancy compared to up to 10 weeks in the U.S. And it's a really interesting look at, how they're navigating rural access to abortion in, very remote areas. Almost all abortions in Sweden are done through medication abortion. And while the majority here are in the 60% versus high 90s. So just interesting how they're taking their approach there as, rural access is limited here.
Really interesting story. Joanne.
This is a piece in the New Yorker by Dhruv Kular, and it's Can AI Find Cures for Untreatable Diseases with Drugs We Already Have? And what I found interesting, we've been hearing about can AI do this? I mean, it's sort of been in the air since AI came around. But what was so interesting about this article is there's a nonprofit that is actually doing it. And they have this whole hierarchy of why a drug may be promising and why a disease may be a good target. And then the AI look at genetics and diseases, and they have 4 or 5 factors they look at. And then there's this hierarchy of making which are the ones we can make accessible. So A, it's actually happening. B, it has promise. It's not a panacea, but there's promise. And C, it's being done by a nonprofit. It's not a cocktail for an individual patient. It's trying to figure out what are the smartest drugs to be looking at and what can they treat. And they give examples of people who have gone into remission from rare diseases. And also, it says there are 18,000 diseases and only 9,000 have treatment. So this is huge, right? I mean, rare diseases may only affect a few people, but there are lots of rare diseases. So cumulatively, some of the people they strike are young. So for someone who doesn't always read about AI, I found this one interesting.
Also, we read so many stories about how AI is terrible for this, that, and the other thing. It is very promising for an awful lot of things. There's a reason that everybody's looking at it.
Right.
All right. My extra credit this week is also from the New York Times. It's called United Health's Campaign to Quiet Critics by David Enrich, who's the Times' deputy investigations editor and notably author of a book on attacks on press freedoms. That's because the story chronicles how United Health, the mega health company we have talked about a lot on this show, is taking a cue from President Trump and increasingly taking its critics to court, in part by claiming that critical reporting about the company risks inciting further violence like the Midtown Manhattan murder of United executive Brian Thompson last year. I hasten to add this isn't a matter of publications making stuff up. United, as we have pointed out, is a subject of myriad civil and criminal investigations into potential Medicare fraud as well as antitrust violations. This is still another chapter unfolding in the big United story. Okay, that is this week's show. Thanks, as always, to our editor, Emery Huneman, and our producer-engineer, Francis Ying. If you enjoy the podcast, you can subscribe wherever you get your podcasts. We'd appreciate it if you left us a review. That helps other people find us, too. Also, as always, you can email us your comments or questions. We're at whatthehealth, all one word, at kff.org, or you can find me on X at jrovner or on Blue Sky at Julie Rovner. Where are you folks hanging these days, Shefali?
I'm at Blue Sky at Shefali.
Sandhya.
I'm at X and at Blue Sky at Sandhya Rates.
Joanne.
I'm mostly at Blue Sky, Joanne Kenen at Blue Sky, and I've been posting things more on LinkedIn, and there are more health people hanging out there.
So we are hearing. We will be back in your feed next week. Until then, be healthy.